Because I think we got to decide how he's going out to bid, because at first he was going to bid it as a whole job. Now I think he's bidding it as like, probably like you or my town together because we're side by side kind of thing. Steve's coming to my meeting in September.
It's coming to ours. He talked to me at the fair about a few things I said.
It's 3 or 4 years now that we've had these water meters, and that this program started through. It started with Senator Gallivan. He gave Barrysburg Water a $50,000 grant that we didn't use in the building of our replacing of lines on Main Street and our new tank. So from there, I went out and was able to buy a lower cost leftover meters from the village of Warsaw. I needed 100 meters. And then from there, got them installed, Hardings did the install. And that's where he bought the reader portion of it and the programming and the licensing for it. And like I was saying to Sandy, my water rents receiver, it's John Knapp's daughter. So for whatever grudge, even though John retired, it just nothing, we were oil and water on things. She asked for a raise. I said, no, all your duties are going down once this gets in place. So now they come over, open up their reader, drive through the hamlet, go back. At this point, they're just looking at it, and it goes out on the county's mailing rate. Their bulk mailing rate. So again, it's a little bit cheaper because it's down. The 5x7 cards go out to the people. They send a check to the same post office box in Barrysburg. She goes in, picks up the checks, and then logs onto a computer program, checks, marks if somebody paid or not. And if they didn't pay, it's the Water Resource Agency that their computer system just rolls it over to the next quarter. I think she has to do something of filing of it on taxes at the end of the year. On their levy if they didn't pay it all. And there's a couple guys that do that. They just don't pay it all throughout the whole year. And ends up on their, interest and on their taxes. So we still get paid, but I've been very happy with it. And Janice hasn't complained to me in the last 2 or 3 years. So.
You're using Water Resource Agency in your district, right?
Good, Lord, sign in.
Susie's on Zoom.
Susie's on Zoom. Hi, Susie.
My biggest problem.
Hi, Jerry. How are you?
Let's say
Can you hear me?
Yeah, it's now 30 feet wide. And
Okay.
very old water line is underneath the road. Before we would just go ahead and dig it up. Now we gotta go through all the signage, all the attenuator box, the whole works for what we used to just go in and dig down and do.
Okay, I call Public Health Committee meeting to order. That was your first one.
First item, is an appropriation, just $6,000 for, it's the medication assisted treatment money for the jail. We can appropriate the full amount we've received it, so this is just to appropriate the remaining amount.
So moved by Supervisor Thatcher. Any discussion? All in favor?
Aye.
Opposed?
Aye.
I don't have another appropriation. This is for the Dwyer Veteran Peer-to-Peer Services Program. The way the state aid comes in is very funky, and it's, like we're still spending 2021 money. We have until the end of this year to spend it, so this is the remaining amount of 2021 money that needed to be appropriated, so they can continue to just spend that state aid.
Motion by Supervisor Griffin, is there any discussion? All in favor?
Aye.
Opposed?
Aye.
Carried. Okay.
Next item is permission to declare executive as sole source. So we received the wages grant funding several months ago. Within that was the initiative to do vaping detectors within the schools. We would purchase the vaping detectors that the schools would then install in bathrooms. Cost is around $24,000 for that. But the ones that they want to purchase, this is the only one that has the battery option instead of they have hardwired ones that can be hardwired in, but then also the battery option. So, that's what I want.
Does it work like a smoke detector or something, does it?
Yes. That's,
I want to play the song Smoking in the Voice Room. That's vaping.
they have the
Classroom.
ability to have the real one, and then like there's a fake one so that they can move it around. And
They're getting pretty good at it.
necessarily know, what one is utilized, and it's technology through the phone that the school can have whoever to be able to bid that, that is going on. So
Evidently, there's a demand for that, big enough problem, they think.
it is, and I mean, it's a problem within schools, that there is a very, increase in vaping, and so each school will use it differently. I think for some it might be a bathroom, the kids know that they can go there, utilize that bathroom, but they won't be having somebody vaping, so.
Smoking in the Voice.
I'll make a motion.
I have a motion by Supervisor Grant. Is there any discussion? All in favor?
Aye.
Opposed? Carried.
First proclamation, September Suicide Prevention Awareness Month. We do have a higher rate per capita for suicide in the county, so it's very important, to make that awareness, known within the community, and resources are available and that people reach out for help if they need it.
How are you advertising that?
I think there's just events that the coalition does, that they have different educational events, and then we have our walk, which is in September, that we have a penny saver. We're doing it in Warsaw, or in Perry this year, which is due for that. So it's just through the coalition and the events that they do.
CJ?
Yeah, I think many of our, yes, we do actually have a contract with CJ that they are doing an ad that will be running for the month of September.
Do you focus on anything toward teenagers?
We do stuff within the schools. Historically, our rates don't show. It's more on older, white males is our demographic, but we do, we don't ignore it. We do stuff within the school on suicide prevention and partners for prevention, and then also within the mental health side. And the walk is open to everybody. We do encourage the schools, each of the schools have a SAD, Students Against Destructive Decisions, and so we encourage them, that we have participation from those groups at the suicide prevention walk, and then utilize those kids within the school to spread that message there.
Motion by Supervisor King. All in favor?
Aye.
Aye.
Oh, carried. Overnight travel.
The permission for me to attend the conference of local and hiking directors, fall mentor and membership meeting in Fairport. 21st. It's beneficial for me to connect with other directors across the state.
And motion by Supervisor Robert. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Just a couple of FYIs, the government center and our mental health department have been lit up purple, slightly pink. From last Wednesday, the 24th to today for Overdose Awareness Day, which is officially the International and Overdose Awareness Day is today on the 31st. The GAO task force did an overdose awareness event in Batavia last Wednesday, so that's why we went for the week. Anybody wonders why it's purple? There should be an article, I think, in the paper today from the task force, explaining why it's purple. And then Partners for Prevention is going to be purchasing our prevention curriculums. We received within that same grant a few months ago the ability to update some of our curriculum. So it's around $8,000. Just wanted you guys to know that doing some digital licensing that they have now for the curriculum. So we're going to be updating that second step program. And then they're going to be purchasing a Parenting Wisely curriculum because they've never done offered a parenting option for the school. So they will be doing that in the future. My last thing is we're doing the Tom Mcconnell Memorial Scholarship fundraiser. So we're having a chicken wing fundraiser again. This will be our second one. It's going to be Sunday, September 18th at the Warsaw Village Park, the Fire Department grounds, 11 to 2. Tickets will be $20. They will be on sale. They're on sale now. I'm getting mine for Bill right for today. So
What was the time?
11 to 2 on Sunday, September 18th. $20 includes 10 wings, carrots, celery, blue cheese, chips, water, and Johnny's ice cream. We're doing drive-through only this year. Pick up and go. So for anybody that's interested, we're also looking for volunteers to work it. So
Anybody have anything for John? Further requests?
thank you.
Okay, Laura. And we will be going into executive session in the meeting.
Good morning.
Morning. That first trigger, I'll grab those three together.
All I would comment is that in-person training opportunities are back, and after a couple of years of Zoom, this is welcome.
Okay. Very discussion on 1, 2, 3. Hearing none, all in favor?
Aye.
Opposed? Carried. Item 4.
So you'll see some munis blanks, and before I go into the details, I want to thank Cheryl for the how-to on this one. The Health Department received over a year ago a grant from New York State through HRI to support the schools in in-person learning. And back in June, I guess, we received word that there would be a 1-year no-cost extension. The bulk of those funds were passed down to the respective school districts. So although we have a resolution extending the end date for the grant, we now need to follow suit extending the end date for the schools. We did just meet with them last week to talk about the upcoming school year and see what their needs may be, discuss opportunities for them to expend the dollars. The state is pretty narrow on allowable expenses, so we did give them some suggestions, and that follow-up is ongoing. This is the housekeeping item to extend that grant.
Any question?
What do they do with the grant? You know, it says-
So last year, when the regulations were abounding, they had lots of required testing, the test to stay program. Staff that elected not to be vaccinated were subject to periodic testing, supplies associated with that, personnel costs associated with that. So some of the schools were more successful at expending their available dollars than others. They all still have funds left on their contracts. So this year, some of the things we talked about were if they made HVAC upgrades to their facilities, that perhaps it would be an option for them to purchase replacement filters, which are pricey. And also some standalone HEPA air cleaners, perhaps for some of the more at-risk environments like special ed and younger kids. So those are all things that we passed to them that we're vetting. I think there's a webinar coming up soon-ish with the state to talk about eligible expenses. Our hope is that they become a little less rigid. And I'll just give you a quick example. It was Letchworth that wanted to replace their traditional water fountains with bottle fillers to improve infection control. Yeah, no, the state didn't love that, which I find absolutely surprising. So let's hope that the state loosens their requirements on eligible expenses. We'll see.
Okay. I have a motion by Supervisor Grant. Is there any further discussion? Hearing none, all in favor?
Aye.
Carried. Okay, item 5.
Emily Wedge, who is a public health nurse, joined the department early in 2020, and then is a special welcome for her way to stop what we were doing for a couple of years and have a pandemic. And now she is really engaging in the programs that she's been assigned to. There are two primarily. It is lead poisoning prevention and the maternal child health program. And so she's actually one of the overnight travels that we had, and discovered that she had not been issued a procurement.
I'll move that.
Have a motion by Supervisor Rogers. All in favor?
Aye.
Opposed? Carried. Okay, professional service contract.
So last month, the board approved the health department accepting the Office of Children and Family Services grant for the Healthy Families New York program. And the proposal that we submitted to New York State that is almost approved includes a subcontract to community action. And this was pretty deliberate on our part. They are very, very networked with a lot of populations. They have a variety of different programs on the safety net side to serve individuals and families in the community. And they were willing to be the subcontractor for this program. So this is much like the Navigator grant, where the health department holds the contract, but subs with community action to perform critical work.
I have a motion by Supervisor Brick. Is there any further discussion? None, all in favor?
Aye.
All carried. Okay, appropriation.
So Supervisor Davis, I have a tiny addendum to that item. Is as part of the RFA process for the Healthy Families New York grant, The state released that opportunity because there were a handful of counties in New York State that did not currently have the program. The program is evidence-based. The state approached us, Genesee County, although they had 2 applications filed to provide services in that catchment area. Those applications were not fundable. And so the state has approached us, the Wyoming County Health Department, asking if we would be willing, in partnership with Community Action of Wyoming County, to take a look, subject to the Office of the State Controller approval, at picking up Genesee County as a catchment area. So I share that there are a lot of moving parts here. We don't know what the dollars are. We don't know what the contracting method looks like, but those conversations are occurring, and I just wanted to share that information with the committee, see if there were any questions or discussion items before we continue moving down that path.
Question?
This model is not unusual, like the WIC program that covers Wyoming County is actually administered by Livingston County. So we're starting to see some more of this in terms of programming, because the state is recognizing that even though it's important for a program to be present in the county, but infrastructure county to county is not necessarily effective. So that's, they decided that rather than re-procure it for Genesee County only, based on the strength of our model and application, whether or not we would consider it. So we're not there yet. I did reach out to Genesee County's Department of Social Services, because their partnership is absolutely essential to this, and talked through it with them. Dave Rumsey is actually getting ready to retire again, and I did meet over the phone at least his hired replacement, Carla. I don't have the last name. So there's agreement in principle there as well for a partnership. I just wanted to let the board know, see if there were any concerns.
Okay, other questions? We move to appropriation.
There are 2. The first one is funeral home transport. If you'll recall, very early this year, we had the funeral homes in the county that do transports for the coroner program digging their heels, and those rates were very, very low and had not been adjusted in my hurry. And so they were adjusted to market rate. We've not had particularly any real difficulty now getting their partnership to make those transports. However, an increase in January means that the funds that were budgeted for this year are insufficient. The next one. People are doing the right things, and so again, the health department continues this time of year. August is often a peak in rabies program activity, reminding people that wild animals are wild and don't have cuteness, and if there is a bat in your home and there is an exposure, to be sure to capture the bat without knocking it into next week, so it can be tested to determine rabies status. So we have had a number of individuals requiring post-exposure treatment. There's always stories that go with them. So these funds, this happens periodically, and Jess, you've been in contact with the budget office regarding this. So these are funds necessary to provide post-exposure treatment. And every one of those encounters is fully vetted to make sure, 1, there was a true exposure. 2, there is not an opportunity for a confinement and observation or an animal's submittal. Or 3, that they don't belong to another county and we can send them over the line to their home county to receive treatment there. It is what it is.
So moved.
Jim? Is it time of year? I have a motion by Supervisor Becker for 7 and 8. Is there any further discussion? All in favor?
Aye.
Aye.
Opposed? Carried. Okay. Building records.
So shout out to Buildings and Grounds. They've been really attentive, as has IT, because we're taking a look at security enhancements at the department as well. Jess has been masterful at working with our existing grant funding streams to identify eligible expenses that are allowable by the grant in order to offset some of the expense. At this point, it is taking shape that if you take a look at number 10, I'm jumping ahead a little bit. The health department has in the center of the north end of the building, right? Environmental health is in there in a cubicle setup. Those cubicles have been around longer than I, and they are held together in some cases with extra materials for safety. Jess was able to identify grant funds to replace those cubicles. And so that's number 10. We've been working with buildings and grounds because the cubicle replacement is on state bid. There is some urgency here because the state is starting to renegotiate those bids. This is a pretty fair price. So what will happen, subject to the approval of number 10, is the side of the building where most of the staff are will have new carpets, squares installed, and the buildings and grounds is taking care of that. And then the cubicles will be deconstructed, the ones that are there will be deconstructed. Buildings and grounds has indicated they want to hang on to them, and then the new ones replaced. What will happen after that is, my impression is buildings and grounds is ordering materials necessary for a renovation to make an employee break area, which we don't have right now, and to make some improvements to the other end of the building previously occupied by veterans. So we're in it for the long haul. Buildings and grounds was very clear that it's, although we're bound to expend renovation dollars in 2022, Mike thought it most likely that that work would occur in the veteran side of the world in the kitchen portion over the winter. So,
Jess, can you get me the state bid number?
I think it's on the process sheet.
Ooh, finish. Okay, which I don't have in the previous.
I also have here. The New York State contract number, is that what you're looking for?
Number 10.
Yeah, number 10.
Near the town.
My gosh, I'm blind. I see it now. Thank you. I don't see it. Oh, no. Yeah, okay. Thank you.
Okay, what else on building renovation? Before we add that?
We're going to be under construction.
Have you worked with Devin on the parking lot?
It's done.
Oh, done.
Yeah, so that was like, I think we brought that last month and within 2 days of committee, like that weekend, the work was done. So it looks nice. Devin and Mike were both pretty clear that the work that was done out there is, it's for now at some point.
Band-Aid.
The parking lot will need some additional renovation at some point, but that's, I think the number Devin floated was 100,000. So we'll take care of what we got as long as we can before anything else needs to happen.
Okay. Anybody have any questions for Laura on the building project? If not, we'll move down to item 10. Motion. Thank you. I have a motion by Supervisor Grant. Any discussion on this one? If not, all in favor?
Aye.
Aye.
Okay, we got, yeah.
FYI, so despite the fact that it just indicated that our funeral home transport system was more stable than it had been in the past, sometimes it occurs that they are just otherwise engaged, whether they have a funeral at their own facility or whatnot. So there was a community fatality at the edge of the county, and Comfort Funeral Home responded and did the transport for us. They are not someone that we've used in the past, and I did talk through with the principal there about what the program looks like and would they be interested in entering into an agreement. The answer was yes, although they've not yet made it through the vendor process in order to get set up to get to a contract, so that is the next. I anticipate following very well. The next two are grant expenses. We are setting up some advertising. One is bus racks on the RTS, the buses. And the second is loan our billboards, grant dollars go.
Okay, operational updates.
So the Board of Health, we did not have a meeting in June. There were no actionable items and our chairman was unavailable at that point. So we are moving back to our regular schedule. We're meeting scheduled for September 15th at the health department and then another in December. COVID response update, the health department continues to offer testing. We are distributing home kits. We are providing vaccinations. Illness level in the community continues to be present. Although underreported, I would say, because a lot of, we're moving, I think, at this juncture from the pandemic response to a more endemic situation. So it's still there. I think that we all enjoyed a little bit of a breather this time last year, and then it was a very active fall and winter. So we will see what comes in, and certainly we'll stay in communication moving forward and provide regular updates to the community.
There's no schools that are requiring masks, right?
That's
In
my
our,
knowledge.
They're not even talking about isolation, are they?
No. No, if you are positive or presumed positive, the expectation is stay home for 5 days. If you remain symptomatic, what the schools do have some latitude to do, the CDC guidance is pretty watery. Says that if you're returning from a presumed or positive COVID episode, that you should wear a mask for an additional 5 days. That really becomes up to the school's discretion, I think is what came up when we talked about it.
Is there an increase in this long COVID? Looked like the president must have had long COVID, you know.
So the science is just catching up with that. So certainly it seems at this juncture with such an enormous number of people having had COVID, that the body of people who are experiencing ongoing symptoms is leading to some more, more clinical and scientific research. I'm not an expert there. Alex?
And just, it sounds like there's a fair amount of it out there. I've heard something like, numbers like 30% of people that actually had COVID with some sort of long-term symptoms. But again, as Laura mentioned, there's lots of scientific studies going on right now trying to figure out what is causing it. And we have a lot of different theories out there. So just have to maybe stay with it and see what evolves.
One other item of interest is there was a vaccine that's due to be approved, I think, later in September. It's bivalent, and what that means is it is specifically formulated to target the variants. So this is a little bit of a timing thing, right? So annually, when we get our flu shots, it's based on the illness that was circulating in the southern hemisphere in spring. So I think they're moving toward that. And the vaccines that are expected to be approved later this month are specific to the 4 and 5 vaccine for virus. So we'll see what the public's appetite is for that. So I left to wait for mine, and I suggested that I do the same, just to see what she's. The next item is the healthcare worker bonus. So this was kind of a surprise on a Friday afternoon, and there have been a lot of updates and Zooms and webinars on some of the finer points of this. This appears to be a program that is specifically intended for people who are providing face-forward clinical care. Okay. Local health does not appear to be eligible. Which was a little small, but it is what it is. That's the way it's written, and it is what it is. Having said that, we have nursing staff inside the health department that have completed the paperwork to be eligible. It's been submitted to the Human Resource Department. HR is taking the lead on this, and Nicole's working hard to try to make sure that everyone that may be eligible understands the program, and understanding the submission process is crazy complicated. So she's taking lead on that. We have 5 nursing staff that appear to be eligible, and then one late-breaking surprise person who just came to us from the hospital, but worked there during the period of time. I think it was October 1st, March 30th is the first vesting period. So 6 total is what we submitted. We will see what comes of it. And I presume this was talked about some at HR committee yesterday. Okay. So hospital staff are eligible. There was a list of sample titles. It doesn't have to be an exact match, but it has to be a match in principle. All those people have to complete attestations, and then the employer uploads the information to the state system. And it appears to be that New York State will provide payment directly to the county, and then those funds will go out, is my impression. A maximum of $3,000 per person.
But I understand you have to apply again.
Yes.
You only get half of that the first go round, and then you have to apply
That's
the
correct.
second go round in the
And I
next
think-
6 months.
And I think there are 5 vesting periods that have been named, starting last year, October 1st, and going through 24. So. NYSATRO, who's our advocacy organization, has really stood up for local health not being eligible except by title on that. We'll see what comes of it. That's what it is.
And Dan Farber mentioned yesterday, it's ongoing. And I had a conversation with the past week ago. It's a huge undertaking for the HR department. They gotta figure out every hour of time worked and whatnot for each individual. It's not an easy task, so.
So you are correct.
You gotta go back through all the records and find out you were 60 hours this week and 42 this week and whatever. It's all gotta come to
Right. And the state has put timelines on submission, right? So the first vesting period is like Friday or Saturday this week. So it's a heavy lift, and eligibility for the full award is based on full-time hours. But if you work part-time or per diem, there's less. You know, you're still eligible, but for a lesser pay. Crazy confusing. Maybe we could do the environmental health and weights and measures reports. Rob, did you have anything you wanted to highlight?
Yeah, I mean, environmentally, we had some harmful algal blooms out there, some of our surface recreational waters. Silver Lake has had one that's been here, there, everywhere. Also, Jellystone Beach, or like the beach down below, had a harmful algal bloom which closed the beach basically for the summer, which is unfortunate. Not sure why these are continuing to pop up, but there's some theories on how to maybe guard against it. We'll see if that comes to fruition. But yeah, it's unfortunate that these are there and they're affecting our recreational waters. It's not from the facilities. But, other than that, we did have most exposure shots. We had another one last month. We're in contact with a bat that could be located for testing. More spoke reports of capturing those animals or staying away from as much as you can. It's easier said than done. Sometimes we saw a video here last week that was absolutely horrific. A woman being attacked by a fox in her home yard. Just, yeah, gosh. Really cool. So, other than that, if there's questions on the environmental health report or the measures.
Is there any way to assess the effectiveness of the rabies, the airdrops of the pellets for the vaccine?
So the airdrops were completed this round again this year, and very, very small portion of our county is included in that. It's the RP area. So it's hard for us to get any information from that because it is such a small portion, but really, I think the hope is to keep it from spreading north. That baby dropping is really an effort to keep it migrating towards Canada. Again, yeah, it's really hard for us to draw any conclusions
the in-laws roadkill.
They do, yeah. Yeah, right. Yeah,
Trends over time based on.
and they adjust their drop areas based on some of that information. So yeah, it's a year by year thing that they look at that. But it's pretty hard for us to draw.
The other day I saw a thing that was just due north and turn around and due south a little bit further over. I mean, that's in Sheldon jail area.
Yeah.
Which I was assuming that's what it was.
It's possible, although that drops were done, I want to say, a couple of weeks. It was into August, but at least a couple of, not 3 weeks ago, that was completed. So whether it was that or someone doing photography or, I don't know.
Looking for jobs, yeah.
Yeah, exactly. So, hard to say.
Okay, anything else before we go into executive session? I'd like a motion to go into executive session to discuss the versus item 7. Second?
I'll second.
Okay. All in favor?
Aye.
She's not out there, I'm just shutting it down.
Thank you.
I'm assuming.